Good evening, dear Medyascope viewers. Welcome to This Week in Turkey. This week, we start the bulletin with a correction relating to the status of journalist İsmail Dükel. While we previously reported he had been arrested, the Tele1 Ankara correspondent has in fact been released. After being referred to a courthouse with a request for their arrest with Oda TV Ankara news editor U.S.A. Yıldız was arrested and Dükel released on condition of judicial control. Yıldız is the fourth currently imprisoned journalist from Oda TV over a news report regarding the death of a national intelligence organization officer in Libya. This week, our guest will be Dr. Derya Unutmaz, who will be joining us from Connecticut in the United States. We will be speaking about the increase in coronavirus cases over the past week and what that implies for the reopening process in Turkey. But first, let's take a look at the developments of the week. As of June 18th, the total number of deaths from the coronavirus in Turkey has reached 4,882. The total number of confirmed cases is 184,031. The numbers have been rapidly increasing since the reopening process began on June 1st, and the weekend curfews have been lifted. Here are the developments of the week.
The number of new daily coronavirus cases in Turkey surpassed 1,000 on June 12 for the first time since late May as the government eased the restrictions taken to fight the virus. Health Minister Fahrettin Koca has warned citizens against faulty optimism and urged them to wear masks, pay attention to social distancing measures, and not to neglect hygiene. As of June 17th, Istanbul, Ankara, and Bursa have joined 42 other provinces where mask wearing is mandatory in all public places. Those who do not abide by this rule will be imposed an administrative fine. While Koca said that they are not at the moment considering the reimposition of curfews to halt the spread of the virus, the Interior Ministry announced that a partial curfew will be put in place for Saturday between 9 a.m. and 3 p.m. during the hours when the high school entrance exam will be taking place in order to avoid congestion before and after the exam. The Istanbul Governor's Office has ruled for cafes and restaurants across the province to be inspected amid the spike in cases and reports that some of the enterprises are not shutting their doors past midnight. The Istanbul police will conduct simultaneous inspections across the province every day to make sure that cafes and restaurants abide by the new health and hygiene rules, as well as social distancing measures. Although most of the cases are still observed in Istanbul, there has been a significant rise in other provinces. Reports suggest that Central Anatolian province of Konya and the southeastern province of Diyarbakır have registered the highest increase since the relaxing of the measures. But there is no official data on the provincial breakdown of the cases, as the health ministry does not announce them. Turkish Airlines will be resuming flights to the United States as of June 19, CEO Bilal Ekşi said on June 12. Initially, the airline will be flying to Chicago, Washington, D.C., and Los Angeles. While flights are predicted to run 3 times a week, Los Angeles flights will be starting a little later on June 24. Turkish Airlines recommended domestic flights on June 1 after months of COVID-19 bans, and international flights began on June 11 with flights to Europe.
This week, our guest is Dr. Derya Unutmaz. Dr. Unutmaz is an immunologist, and he's the head researcher at the Jackson Laboratory in Connecticut, United States. Good evening, Dr. Unutmaz. Thank you so much for joining us this evening.
Thank you.
So as of June 12th, the number of positive cases has steadily increased in Turkey, surpassing 1,000 a day. Would you say that we are back to where we started in March, or are these numbers normal in light of the reopening process? How should these numbers be assessed?
So, of course, the increase in the case numbers based on tests are quite worrying, because what you really want to do is to get those to maybe even to single digits, and you want to see steady progress and decline of the number of cases that you find. I don't think it's the same as beginning of or middle of March, because of course we have much more wide range of surveillance in terms of tests, and there are more precautions are being taken, and the significant portion of those who are testing positive are actually not really the sick patients, because they're reaching out to more asymptomatic, trying to identify asymptomatic individuals. But of course, the fact remains that when these cases do not go down, that there are many, many thousands more who are out there who are continuing to spread the virus, means that we're not able to control it. as we should. It is a worrying trend. Hopefully, it will start to go down again.
Dr. Unutmaz, there's also, I think, this confusion about waves versus peaks. It is widely assumed that the rise of cases after the virus has been taken under control is the emergence of a second wave, but many experts have said that we're still in the first wave and that a second peak within that wave is emerging. Can you tell us about the difference between the two terms and where Turkey stands in that regard?
Yeah, there's a lot of confusion about this notion of waves. If you think of this as like one big storm, the waves are initially very large, and then they start to get smaller. But we're continuing to see the continuation of the first storm's waves. I think it makes sense to talk about second wave in a country like China, for example. They have really controlled the infection. They had almost no cases, but you can see that now in the recent days, they're finding cases in Beijing. I don't think it's a full-blown wave yet, but if that keeps growing, then perhaps we can say that's a second wave. But we are seeing, sort of the smaller waves that are continuing after the big large wave, and probably until fall this will continue to be the case.
Because Minister Koca, as you know, the Health Minister Fahrettin Koca had previously expressed that they were not awaiting a second wave in Turkey. I mean, is that even preventable? And if it's not, are there ways in which to come through it with the minimal damage to the public? I realize that the economy is a whole different story, but how can Turkey survive in a better way a second wave to come in the spring season?
I think, to respond to that, public health official in U.S., Dr. Anthony Fauci, made the best comment. He said the virus is going to decide. I think, I would add to that, it's not just the virus, but the whole society will make that decision, because to say that you're not expecting a second wave requires that everyone in the society takes the preventive measures, wear their masks, social distancing, because the virus does not stop. And initially there was talks about this herd immunity, that we would reach a certain population and they would be immune to it, and so that this will kind of will be gone by fall. That is not the case, and it is really very tragic to talk about herd immunity. There are some countries who try that, and they're paying the price for it. So we don't know. It will really depend on how well certain countries control this. And if you look around the world, there are countries who have done a fantastic job. They have a couple of cases here and there, but they really had it under control. And those can say that we're not going to expect a second wave, but I really can't say that for Turkey or U.S. or for many countries in the world.
It's interesting that you mentioned that, because the authorities in Turkey have kept propagating this discourse of Turkey's success story in fighting the virus. And considering Turkey at the moment is 12th in terms of the positive cases worldwide, I guess we can't say that it's really a success story. And how does this discourse perhaps relate to the way in which the general public has acted? Because as you mentioned, it's important to follow the rules, but we've been seeing images from around Turkey where as a matter of fact, people haven't been following the basic rules of wearing a mask, as well as social distancing measures. So how can we perhaps, can we explain this perhaps relaxed attitude in light of the success story discourse?
So, I've, of course, I've been observing Turkey for the past 3 months. I live in the U.S., but, I'm from Turkey. So I have, close interest there to understand what's going on. I have to say that there is a major success story in Turkey, and that is the healthcare providers. They've done a fantastic job. The doctors and the ministry, and they've tried to take every precaution they can. and the Turkish hospitals were not overwhelmed, and the mortality is much lower than you would have expected when you compare it to many countries in Europe, even U.S., which went through a complete nightmare. So there are some success stories there. But I think the success from now on is really going to depend on the society, on people in the streets, because you cannot lock down a country indefinitely. That is not sustainable in anywhere in the world, and the U.S. is not able to do that either. You can do partial lockdowns in certain cities and certain villages, but this past 3 months should have given us the time to educate the public, to provide enough masks and so on, and take precautions in closed environments, because the virus really spreads in closed contained environments, and increase the number of tests and so on and so forth. So we should have been prepared, and I'm not entirely sure that that sort of knowledge or understanding has been gained by the public. And I have to say, this is also true for United States. At least certain states, people don't really care very much. And there's going to be a big price to pay for that, unfortunately. So I think the recent measures of enforcing mask use, is a very important step. So in these kind of situations where the public health is critical, you have to enforce the laws. You have to say you have to wear your mask, otherwise you're going to pay a fine for that, so that you don't endanger other people's lives. But we'll wait and see what will happen.
Well, you as you said, the virus spreads more easily, I guess, in closed areas. And as you know, as of May 11th, hairdressers and shopping malls, both closed areas, have reopened in Turkey. Weekend curfews have been lifted. Cafe, restaurants, sports centers, and so forth have reopened. And this upcoming week, this weekend, for example, there's a high school entrance exam that will take place, as well as the university exam at the end of June. Again, weddings will be allowed as of July 1st, and cinema theaters are planning to open their doors on July 17th. So out of all of this, what restrictions should be further continued, and on which fronts should Turkey take certain steps back to be able to contain the virus once again?
I think, this so-called normalization is going too fast. I really think that this needs to be done in a more sort of slow and methodical manner. And some countries and some states in the U.S. are actually doing that. And they are modifying the responses based on how the public reacts to it. So I would not open environments where there is no necessity, and they're closed environments, such as closed theaters, for example. I think everyone can watch their movies at home. Of course, that's not good for theaters, but you have to think of the public. That's a closed environment. You cannot control, and people don't need to go there. Or the restaurants, if they are open, you have to bring certain rules that you cannot have more than 25% or 50% of your customers that you used to have. You have to have this social distance. Your ventilation has to be very proper, because the virus can actually circle around the room. I'm not entirely sure what the rules are. And then these university and high school exams are very, very concerning. So I don't understand the rationale for that. It doesn't seem like that was well thought out, because on the one hand, they said, you have to wear a mask until you get into the exam, but you can take off your mask. But it's a closed environment, so you shouldn't take off your mask. But then you're taking an exam, so how are you going to keep the mask, which actually limits your oxygenation, and there's a psychological pressure and fear. So it will definitely affect the performance of the exam for certain children, and this is very sort of unfair, and really should have been thought out better than rushing out and let's just do an exam and let's get it over with, type of a thing. So those are major concerns. So you really need to do this in phases, and people need to remember, we still don't quite understand how this virus spreads. We know a lot more than we did. but you have to be on the precaution side, and you need to take extra measures just in case. People might say, well, this is just too much. But if you don't do it, then this continues indefinitely. And in the long term, it's actually much more damaging.
Well, now I think earlier today, a partial curfew was announced for this weekend, so that the day would be, it would be a day for the youngsters. But obviously the exam is still going on, but I guess the circulation is going to be affected. Dr. Unutmaz,
Yeah, just to add a comment to that. Again, that's sort of I don't understand the reasoning for that. You're allowing 1 million people outside who actually are probably the primary source of the infection, by the way, because young people, they don't get sick very much, but they get infected asymptomatically at around the same rate as older people. So the concern is that they may not get sick themselves, but they might go back to their homes and spread it to their families. I don't think that these things have been thought out very well.
Dr. Unutmaz, you mentioned earlier that part of Turkey's success story was indeed the low mortality rate. So I'm assuming here that the treatment has been rather successful in Turkey. Can you tell us about the treatments conducted in Turkey to coronavirus patients?
So I don't know a whole lot of details, but what I do know is that from some of my friends and colleagues, they're medical professionals, doctors, that they were actually quite proactive. They've tried certain things that weren't yet proven, and not all of them were effective. But they had the foresight to do certain treatments, especially to patients in ICUs. For example, giving drugs that are used in blood thinning, because it turns out that we understand this virus is clotting the blood, and that is a major, perhaps a contributor to mortality. And so I think it was more of the maintenance effect that reduced the mortality, and sort of trying certain treatments based on their experience and sometimes intuition. Whereas I think doctors elsewhere were a little bit slower because, for example, in the U.S., the medicine is very defensive. So they don't want to try things that are for sure proven, and they're afraid that something is going to happen. So again, I don't know exact reasons for it, but it was, trying to take care of the patients. I think another important reason perhaps that contributed to low mortality is that this virus affects elderly. So the majority of people who die are over the age of 60, 65. And in US, for example, or in some parts of Europe, a lot of elderly live in nursing homes. And they, once the virus gets in there, it just sort of devastates that environment. Whereas in Turkey, I think there are more family ties, and people really take care of their parents and grandparents. And I think the government was quick to react on that. They banned their going out for a while. So I think it's a combination of various factors. Turkey has a more young population that might have contributed as well, because, as I said, there's low mortality in the younger population. But they've done a good job in at least handling that initial load of thousands and thousands of patients.
Yes, it's interesting to look at cultural reasons as opposed to medical ones when trying to assess and understand the numbers. And Dr. Unutmaz, I think this week there was a statement released by Oxford University relating to a drug that was found effective in the treatment of advanced patients, preventing death, basically. Is this a major breakthrough?
So this drug called Dexamethasone is actually a very old drug. It's been used, I think, for 60 years or maybe even more. It's a major drug that suppresses the immune system. It's part of a set of drugs called steroids. And it's very frequently used in conditions where there is an overreaction of the immune system. For example, in sepsis, where the overload of bacteria causes immune system to respond too much, and that can actually cause that can kill you because of your immune system. So you want to suppress that. And there are conditions, allergic conditions, and autoimmunity conditions where this is used. But it's also a dangerous drug because it's kind of like double-edged sword. You don't want to suppress your immune system when you're fighting an enemy like a virus or a bacteria. So the time that has to be given is really critical. But what people have observed is that the patients who are in the late stage, their severity is actually caused by this overreaction of the immune system, and perhaps a portion of those patients are dying because their immune system wasn't able to control the virus properly, and it just overreacted, and now it's destroying their own tissues. And so that was the rationale for doing this trial. It's a cheap drug, and we haven't seen the sort of the manuscript of the paper published yet, but this is a very large trial called Recovery in UK, where about 11,000 patients are followed, and it's not just this drug. They're also trying several others. For example, this malaria drug, hydroxychloroquine, that trial was stopped early because they didn't see any benefit at all. Whereas with this drug, what they found is that in severe patients who require either oxygen or they had to be hooked up to a ventilator, they're really in severe condition, they benefited because the mortality in those groups were dramatically reduced. In one case, the ones on ventilator was, I think, about 40% was less. The ones requiring oxygen was about 20%. So about a quarter up to a third of severe patients seem to have benefited from this trial. And the other important thing about this trial is that it's a randomized trial. What that means is that you have a group of patients that you don't give this drug, and the group of patients you give this drug. And then you see what happens in those two groups. If you don't do those kind of trials, then you'll never be sure. And I think this malaria drug shows that we could never be sure. Is it good? Is it not good? Or when do you have to give it? But again, I have to caution that this drug needs to be used by medical in hospital, and people should not go and buy it and use it. They can actually be harming them. In fact, in that trial, they didn't see any benefit if the drug was given earlier in hospitalized patients. Because, as I said, it's suppressing the immune system. So in fact, if you take it too early, it might even be detrimental, or it might harm you because you're going to suppress your immune system who's supposed to fight with the virus. But it's very encouraging because it's an available drug. We know the side effects. We can control it. It's cheap. And if it saves, they calculated if this drug was used in England alone, it would have saved like 5,000 people's lives. So that's an important piece to this. And the last thing I want to mention related to that is that, in this disease, we're going to find perhaps not one big miracle, but advances in these treatments, piece by piece, we're going to get to a point where we can reduce the mortality much to a more reasonable level.
Mm-hmm. Some experts are, the guesses, I guess, are from 6 months to all the way up to 3 years. So in terms of vaccination, I know there was around 90 studies that were being conducted up until recently. Can you tell us anything about those studies and how, as you said, it's maybe slow, it's advancing slowly, but could you tell us anything about those studies as of now?
Yeah, so it's pretty much the same what I said about this several months ago, that a vaccine is going to take a longer time. There's a lot of hype about vaccine, of course, a tremendous amount of effort, but typically vaccines take years. We are going perhaps too fast because what the limiting factor in vaccine is that you have to test it on people. You have to test to make sure that it doesn't harm people. That's a very, very important thing, because if the vaccine ends up harming people, then there's going to be a whole sort of backlash to vaccines, because you're going to be giving vaccine to healthy people who are not sick, who have not gotten the virus yet. So the public has to be really sure that they're not going to be harmed by that. And there's already sort of a negative view of vaccines in the world, totally unjustified, because vaccines saved more lives than anything else. But we have to be careful. Then we also need to test this in large number of people, tens of thousands of people who are healthy, who don't have the virus, and to see and wait months and months what portion of those people will get infected. For example, if you cannot test the virus in a vaccine in China anymore because there are too few cases. In fact, the Chinese company, they're starting a clinical trial in Brazil. There's a lot more cases in Brazil right now. So I think the most optimistic sort of prediction would be, in my opinion, by sometime fall or late fall, we might know which one of the vaccines that are being tested have the most potential in terms of the results that we get, that looks most hopeful. Because you cannot also keep testing 80, 90, 100 vaccines. That will just consume too much resources. So we have to reduce it to several. And then those, as we wait, to the next year, I think we'll know. We'll also know a couple of other things, like what is the duration of protection. We don't even know in a natural infection setting how long a person will be protected if you have been treated for the virus. 6 months, a year, is the immunity going to last? Which age groups are going to be more effective? Old, young, middle age? So there's all kinds of questions that we have to try. And I don't foresee a widespread spread use of vaccine before 2021. The earliest would be maybe next spring. But treatments is another story. Treatments are, as we just talked about it, are going much faster, and they will go faster. And I've made that prediction before, because you're testing that on sick people. So you can do these clinical trials quicker, you get a result, especially in a case where it's a life and death. That's kind of a no-brainer. So we're having a lot of new treatments that are coming to the clinic, like antibodies and so on. So I'm more hopeful about that at least we'll be able to manage the virus, the infected people or sick people, until we have a vaccine. So I'm very hopeful about it, but this is a process. It's going to take time. Yeah. That's why it really depends on people to keep it that way until we do.
Yes, and in the meantime, follow the rules so that we don't overload our hospitals and our healthcare workers. Dr. Derya Unutmaz, thank you so much for making the time and joining us this evening.
Thank you.
The People's Democratic Party began its Justice and Democracy March on June 15th under heavy police presence and detentions.
The march began from the western province of Edirne and the southeastern province of Hakkari and is expected to end in the capital Ankara on June 20. The march was decided after 2 HDP deputies and 1 main opposition Republican People's Party lawmaker were stripped of their parliamentary statuses. At least 10 people were detained in Istanbul's Silivri when police dispersed HDP members heading to Edirne. Tear gas and rubber bullets were also used. The governor's office of the northwestern province of Tekirdağ banned entrances to the province for 3 days, starting early on June 14, stating that the HDP's march might create a risk in the fight against the coronavirus. Law faculty member at Dicle University, Vahap Coşkun, assessed the need for such a march to be held by the HDP to Medyascope news anchor Gökçe Çiçek Kösedağı. Vahap said, "The HDP has been under political pressure for the last 5 years. In the period after the peace process ended, HDP has been forced to face both actually and legally many difficulties. The former co-chairs of the party are currently in prison. Many of its deputies have been stripped from their MP statuses and sent to prison. Mayorships which they won during the elections have been appointed trustees. Lastly again, 2 of its MPs were stripped of their statuses. Thus, HDP has wanted to give all of this a political answer. This need comes from both its party constituents as well as their voters. The march decision was taken as a democratic reflex in the face of everything they have been forced to live through." The 2 locations, Edirne and Hakkari, where the march has kicked off, also has a symbolic meaning. It demonstrates HDP's efforts to be a party for Turkey, as opposed to how the mainstream media is describing them. The march is a constitutional right. The constitution says that everyone is allowed to organize a peaceful march. So when you look at it through this perspective, the government and security forces should take the necessary precautions so that they can execute their democratic rights. However, the issue is not a legal one only, there is a political dimension. Meanwhile, a man was arrested for sexually harassing former People's Democratic Party co-chair Selahattin Demirtaş's wife, Başak Demirtaş, on social media. Under the Twitter name Vedat Muti, seen to be a supporter of the ruling Justice and Development Party, he threatened to sexually assault Demirtaş, prompting outrage on social media. Thousands of Twitter users sent messages of support to Demirtaş with the hashtag #WeStandWithBaşak Demirtaş. Regarding the matter, the Demirtaş family lawyer Mahsuni Karaman told Medyascope correspondent Ferit Aslan, "The public at large reacted strongly against such an ugly attack. I think the fact that the public has such a sensibility will bring about a positive development in terms of the cleanliness of social media. This attack will hopefully lead to an increase in sensibility for the way in which social media is being used. The fact that immediately after the attack, the individual was interrogated and later arrested will hopefully lead to cleaning up the dirty language in circulation on social media platforms." Karaman, nonetheless, pointed out that unfortunately the judicial system in Turkey was not independent and arbitrary, and that prosecutors await orders from the justice minister in order to conduct investigations on such matters.
On June 11th, Twitter disclosed of 3 new state-linked information operations that have been taking place on its platform this year. One of them includes Turkey and is linked to the ruling Justice and Development Party. The 7,340 accounts and their content were removed from Twitter.
Twitter said the suspensions were part of a broader operation in which it had removed and suspended accounts linked to state-run propaganda and disinformation centers in China, Russia, and Turkey. These accounts consisted of a network of echo chambers. A network in Turkey was determined to be pushing politically themed tweets aimed at Turkish-speaking users. Based on our analysis of the network's technical indicators and account behaviors, the collection of fake and compromised accounts was being used to amplify political narratives favorable to the AKP and demonstrated strong support for President Recep Tayyip Erdogan, Twitter said. Tweets were seen to have promoted the 2017 Turkish constitutional referendum, which consolidated power in Erdogan and worked to increase domestic support for Turkish intervention in Syria. There were also English-language tweets that attempted to increase the international legitimacy of Turkey's offensive in northeastern Syria in October 2019. Erdogan's Twitter account was either mentioned or retweeted 1.7 million times. Other accounts that the network frequently retweeted or mentioned included the AKP's, Presidency's, Treasury and Finance Minister Berat Albayrak's, Justice Minister Abdülhamit Gül's, and former Ankara Mayor Melih Gökçek's accounts. The accounts and their content have been removed from Twitter but will be archived on a database for research. In response, Turkey has accused Twitter of trying to protect terrorists and redesign Turkish politics. In a statement released from Twitter, Presidential Communications Director Fahrettin Altun said, "We would like to remind this company of the eventual fate of a number of organizations which attempted to take similar steps in the past." In his statement, Altun also said that the documents cited in Twitter are clearly unscientific, utterly biased, and politically motivated, while deeming the move a scandal of historic proportions. Academic and cyber rights activist Professor Yaman Akdeniz evaluated the decision to Medyascope's Burak Tatari, saying Twitter has unearthed the tip of the iceberg. There are many details regarding the 7,340 accounts that we do not know. For example, the name of these accounts were not disclosed. We do not know the relationship they have with other troll networks, their relation to political parties. The second issue we are unclear on is whether or not this is an active troll network. When you look at the tweets, they are all old. Twitter might have simply aimed for easy targets, a troll network which is inactive or not very active. Nonetheless, I think this is really going to bother the government.
A second earthquake with a 5.6 magnitude shook eastern province of Bingöl on June 15th. Hours after a 5.7 earthquake had hit the city.
The epicenter of the earthquakes was the Karlova district, officials said. On June 14, the quake hit at 5:24 p.m., killing 1 person and injuring 9 others. Dozens of buildings were damaged, Turkey's Disaster and Emergency Management Directorate said. The second quake struck at 9:51 a.m. on June 15. Vice President Fuat Oktay, Interior Minister Süleyman Soylu, and Environment and Urbanization Minister Murat Kurum arrived in the province to supervise the relief efforts. Vice President Oktay stated that several homes, schools, animal shelters, public housing units, and the police station were heavily damaged and some were demolished. He said all of the country's aid agencies were currently at the scene and that more than 1,300 tents were delivered to the region and warm food was being distributed to residents.
Amnesty International has released a statement on the government's restrictions on freedom of speech during the pandemic.
The statement says that Turkish authorities have been using criminal law provisions to target people discussing the pandemic online under the guise of combating fake news, incitement, or spreading fear and panic. Between March 11, when the first positive case of the infection was declared, and May 21, the Cyber Crimes Unit of the Interior Ministry alleged that 1,105 social media users have made propaganda for a terrorist organization, including by sharing provocative coronavirus posts. Of these, 510 were reportedly detained for questioning. The statement also holds a subheading relating to media repression, where it details the pressure exerted on journalists and media workers. The statement also includes information on how the authorities have targeted individual doctors and the Turkish Medical Association for challenging and criticizing government health policies since the start of the pandemic. Finally, the statement concludes that the social media users, journalists, doctors, and others who express different views than that of the government are not undermining the fight against the virus, they are strengthening it. And information sharing, scrutiny of public decisions, and open discussion are the best ways to tackle the pandemic and save lives.
The 2019-2020 Champions League, suspended since March because of the pandemic, will be completed in a final 8 in Lisbon in August instead of Istanbul.
A series of one-off matches will begin in Lisbon on August 12, with the final on August 23rd. European football's governing body confirmed. The league's final was initially due to be played in Istanbul at the end of May, before the COVID-19 crisis took hold. Istanbul will now host the 2021 final instead. Portugal's credentials to host a Champions League mini-tournament were boosted by the fact that it has not been as badly hit by the pandemic as other Western European countries, and it has no clubs left in the competition. UEFA President Alexander Ceferin said no decision would be made on whether to let spectators in until mid-July.
That's all from This Week in Turkey. See you next Friday at 9 p.m. Good night.